Hey everybody, thanks for joining me today, Dr. Ross Marcagiani at Turnpaugh Health with another great word of the week. Today's word of the week is going to be pregnancy complications. So we're going to talk about more of the common issues that can arise in pregnancy. The main ones being nausea and vomiting, leg cramps, gestational diabetes, and preeclampsia. So these are all pretty large topics that we could probably have an entire discussion just with one of these. So it is going to be very cursory overview, but go over some highlighted points to be aware of and how we could prevent or decrease the risk of these occurring. Let's dive in. So nausea and vomiting, or hypermemesis gravidarum. So basically means nausea and vomiting. About 80% of women experience this during pregnancy. It typically is self-limiting, meaning it's usually not a big deal. Easy to say when you're not experiencing it, but it doesn't typically, it's not bad enough where it creates electrolyte imbalance and decreases or causes a risk for nutritional deficiency to the mother and the fetus. But in cases where the nausea and vomiting is that bad, it can get that bad to the point where the mother is dehydrated, which is dehydrating the baby and decreasing the amount of nutrients that the baby is getting. At that point, it is advisable to go to the hospital where they would do IV fluids and they would potentially do a feeding tube depending on the severity of it. Some things to help prevent the nausea or help decrease the chances of nausea would be B6 or in the form of P5P, pyridoxal 5-phosphate. Anywhere around 30 to 20 milligrams daily has been shown to be efficacious in research in reducing nausea and vomiting. Vitamin K and vitamin C in combination together, not separately, but in combination has shown to be helpful. Thiamine, niacin, and some ginger root have also showed to help decrease nausea and vomiting. Next, leg cramps. Roughly 50% of women deal with leg cramps. Typically, in regards to nausea and vomiting as well, real quick, also high protein has been beneficial, which is shown to slow down something called gastric wave dysrhythmia. Compared to having a higher carbohydrate diet or a high fat diet. So again, high protein diet has shown to slow down that gastric wave dysrhythmia, which causes some of the nausea and vomiting. So back into leg cramps here. So roughly 50% of women deal with leg cramps. Typically most commonly occurs in the third trimester. Very beneficial, around 300 to 500 milligrams daily of magnesium, calcium about 1 gram, consuming vitamin B, vitamin C, all have been helpful to show a reduction in leg cramps. Most importantly, where people miss the mark is using these vitamins synergistically or in combination together, not using one in an isolated form. Using them all together has shown the best effectiveness for reducing leg cramps. So something to be aware there. Next, gestational diabetes. So this is a big one that's pretty common. How is it typically tested for? You go in and you do your oral glucose tolerance test. So typically given about 50 grams of glucose solution, and then your glucose is tested about an hour later. There's a little bit of debate between 130 and 140. Just to make it simple, it should be 140 milligrams per deciliter or less. Anything higher than that is considered to fall into the category of gestational diabetes, which typically only occurs during pregnancy. Usually once pregnancy is done, the blood sugar stabilizes and normalizes and that label of gestational diabetes is removed. The issue here is this can result in macrosomia, which is just basically a heavy birth weight of the baby. And it can cause for difficulties. Obviously, if the baby's larger, you're not going to be able to have the baby vaginally. It's more common to have C-section, and then you can also put the baby at risk for having more hypoglycemic events after birth, meaning you have to feed the baby more. The baby's blood sugar has more highs and lows, so the blood sugar is not as stable. So now you're having a fussier baby, leading to more potential blood sugar complications. So that's something that you want to make sure we try to avoid. Some corrections: you can try eating smaller meals, eating more frequently instead of 1 or 2 meals, larger meals a day. Obviously, avoiding our simple starches or simple carbohydrates. Try to consume low glycemic index foods, so not having foods that are really high in sugar. Some common ones would be like your white starches, breads, pastas, cakes, pies. Making sure you're staying away from some of your tropical fruits. Those have higher glycemic indexes. That's papaya, mango, pineapple, watermelon, banana, orange. Stick with more of your fruits. Those would be better options for low glycemic index foods. Obviously, good veggies, good fat, good protein are going to be lower GI foods. We talked about this already: consuming low carbohydrate diet and eating more complex starches, sweet potato, yuca, cassava. White potato can be a little bit of a high glycemic index food, so I would try to keep that minimal. You can do your quinoa, your wild rice is going to be a little bit more complex starch. We want to try to avoid coffee. Coffee in pregnant women causes for a decrease in glucose tolerance, so meaning that your receptors aren't as sensitive to glucose. And then some supplementation: chromium, B6, biotin, vitamin D, vitamin C. There's some evidence that shows potentially iron also helps to reduce blood sugar levels as well. But these are all really good things that can be used here. Then we're talking about preeclampsia. Okay, so this is roughly around week 20 of gestation. So that means basically there's a difference between gestational age and fetal age. Fetal age is the day of conception, and then your gestational age is from your last cycle. So typically gestational age is 2 weeks behind. But anyways, so roughly around 20 weeks of gestation. And it's usually a triad of symptoms, meaning 3 things occur to be labeled preeclamptic. So hypertension, basically blood pressure greater than 120/80. So typically in the high 120s or even 130s, 140s, and then over in the high 80s, 90s, and in some cases even in the hundreds for the bottom number. Proteinuria, meaning protein in the urine, you're peeing out excessive amounts of protein. And then edema would be swelling, fluid retention. Some things to be concerned of: we have increased risk of fetal and maternal morbidity and mortality. In severe cases, we can have seizures that occur with this. Now when seizures occur, you fit into eclampsia, not preeclampsia. And you can also have potential renal hepatic dysfunction as well. So some tips here is adequate protein intake. There's actually a diet called the Brewer diet, which is 80 to 100 grams of protein daily, actually showed to help reduce edema and hypertension. Talking about potential IV nutrition, so one of the modalities is actually used in conventional medicine is IV magnesium sulfate to help reduce the swelling and reduce the hypertension. And we can actually do magnesium IVs or IV nutrition as well at Turnpaugh Health and Wellness. Adequate salt intake and trace minerals. I know that sounds a little counterintuitive, but some research is done, and they compared women with reduced salt intake and women who continued a normal salt intake, and they found that the women with reduced salt intake, and both of these categories had preeclampsia. The preeclampsia actually got worse compared to the salt intake group. So continuing good salt intake and trace minerals. And again, you can see here magnesium, B6, calcium, vitamin E, C, zinc, L-arginine, which helps to dilate the blood vessels, so that will help to lower blood pressure, and selenium are all ways to help lower blood pressure, reduce some of the protein in the urine, and edema. I hope this information was helpful. Again, it was very cursory overview. If you have more questions, please don't hesitate to reach out. And if you know anyone who would benefit from these tips, please share this information. I really appreciate your time, and have a wonderful day.